Good morning, doctors. Welcome again. Today we are going to discuss about endocrinology and diabetes. A 44-year-old woman has lost weight over 12 months. She has also noticed episodes where her heart beats rapidly and strongly. She has a regular pulse of 90 beats per minute. Her ECG shows sinus rhythm. What is the most appropriate investigation to be done? Do TFT thyroid function test. The patient has paroxysmal atrial fibrillation. That's why there is no arrhythmia in between attacks from the given option. TFT is the appropriate test as thyrotoxicosis is the leading cause of paroxysmal atrial fibrillation, and this lady's weight loss also makes thyrotoxicosis as a probable cause here. Okay, now a 45-year-old type 1 diabetes mellitus had an annual checkup. Ophthalmoscopy showed dot and blot hemorrhage, hard exudate, and multiple cotton wool spots. What is the next step in management? Non urgent referral to the ophthalmologist. Non-urgent referral to ophthalmologist. It is pre-proliferative retinopathy. So non-urgent referral. If proliferative with neovascularization, urgent referral. Okay. Now, 38-year-old patient presented with tingling numbness, paresthesia, respiratory stridor, involuntary spasm of the upper extremities. She has undergone surgery for thyroid carcinoma a week ago. What is most likely diagnosis? What is the key? This is hypocalcemia. What is the cause of this condition? Hypocalcemia may be due to accidental parathyroid gland removal during thyroidectomy, and respiratory stridor is due to laryngospasm is a feature in hypocalcemia which may cause stridor. 44-year-old patient has sudden onset of breathlessness and stridor. Few minutes after extubation for thyroidectomy, patient had long-standing goiter for which he had the surgery. What is the diagnosis? It is tracheomalacia. Tracheomalacia. Prolonged pressure over trachea by goiter is caused by tracheomalacia following thyroidectomy. 54-year-old woman has presented with episodes of abdominal ache, vomiting and postural hypotension. She also has a dark pigmentation of her skin. A diagnosis of Addison disease was made. What is most likely electrolyte abnormality expected in this patient? Here is low sodium and high potassium in Addison disease. Low sodium and high potassium. Yes. Okay. Addison disease, the sodium chloride carbon dioxide levels are often low, whereas potassium level is very high. Okay. 35-year elderly patient, an elderly patient who is known to diabetes mellitus represents to the hospital with drowsiness, tremors, confusion. What is next? Investigation should be done to help in further management. Do blood sugar in such case. Maybe patient in hypoglycemia or in hyperglycemia. So we need to rule out by doing blood sugar. Okay. Okay. 34-year-old woman is referred to the endocrine clinic with a history of thyrotoxicosis. At her first appointment, She is found to have a smooth goiter, lid leg, and bilateral exophthalmos with puffy eyelids and conjunctival injection. She wants to discuss the treatment of her thyroid problems. As she is keen to become pregnant, what is the most likely treatment you would advise? In such condition, the treatment is propylthiouracil alone. What is the reason? Other drug options. Carbimazole is teratogenic, can cause spina bifida, cardiovascular malformation, hypospadiasis, etc. If become pregnant, PTU is the other hand relative safe in pregnancy. Okay. 29-year-old woman presents to the GP with history of weight loss, heat intolerance, poor concentration, palpitations. Which of the following is most likely to be associated with thyroiditis or associated with viral infection? Reduce uptake of thyroid skin. Key is reduce uptake of thyroid skin. What is the diagnosis? It is diagnosis is decurvin or subacute thyroiditis. What is the point in favor? Viral or subacute thyroiditis diagnostic criteria. Features of hyperthyroidism present. Pain thyroid not mentioned. Investigation ESR 60 to 100 not mentioned. Reduce uptake of radioactive iodine by the gland. Okay. A 67-year-old man presents with polyuria, nocturia, BMI is 33. Urine culture negative for nitrates. What is the next diagnostic investigation? Do blood sugar, age at present, and class 1 obesity favors the diagnosis of type 2 diabetes mellitus. Okay. Now, 29-year-old lady came to the ED with complaints of palpitation that have been there for the past 4 days and also feeling warmer than usual. Heart rate 154 beats per minute, irregular rhythm. What is the treatment of her condition? Treatment by beta blocker propranolol. Okay. Beta blocker that probable arrhythmia is atrial fibrillation secondary to thyrotoxicosis. Some of the symptoms of hyperthyroidism, such as tremors, palpitation, which are caused by excess thyroid hormone acting on the cardiac and nervous system, can be improved with a number of hours by beta blockers. So, to rapid control the symptoms of thyrotoxicosis, beta blockers should be used, which will improve the arrhythmia as well. A 60-year-old man with a 4-year history of thirst, urinary frequency, weight loss, with deep painless ulcer on heel. What is most appropriate investigation? Blood sugar, the probable development of diabetic foot. Yeah. Okay. A 47, sorry, a patient presents with weight loss of 5 kg. Despite of good appetite, he also complains of palpitation, sweating and diarrhea. He has a lump in front of his neck which moves on swallowing. What is the most appropriate diagnosis? This is goiter. Okay. A 45-year-old man with colon cancer now develops increased thirst, increased frequency in urination and weight loss. His fasting blood glucose is 9 millimoles per liter. What is most appropriate management here? So, management here by oral hypoglycemic. Okay. Increased thrust frequency in urination along with weight loss is suggestive of diabetes mellitus, supported by fasting blood glucose of 9 millimoles per liter at the age of 45. Most likely a type of diabetes is non-insulin dependent diabetes mellitus or type 2 diabetes mellitus, which is treated by oral hypoglycemic agents. A 60-year-old diabetic patient on anti-diabetic medication develops diarrhea. What is the most likely cause of his diarrhea? The most likely cause of his diarrhea is autonomic neuropathy. Yes. A 79-year-old woman has been diagnosed with type 2 diabetes mellitus. Her BMI is 22, random blood sugar are 10, 8 and 10 millimoles per liter. Her blood pressure is 130 by 80 millimeter mercury. Her fasting cholesterol is 5.7 millimole. She is currently symptoms free but has microalbuminuria. What is the single most appropriate drug management? AC inhibitors and statin. Diabetic patients are developed statin irrespective of cholesterol. Advocated statin irrespective of cholesterol, and diabetic microalbuminuria is best treated by AC inhibitors, as initially we shall give lifestyle advice and no medications for diabetes. Even then, when we shall start with statin and AC inhibitors. Okay. 46-year-old woman has weight gain, sensitivity to cold, pulse 50, heart is enlarged with murmur. What is the single most likely diagnosis here? Here the diagnosis is hypothyroidism. The given symptoms are classical presentation of hypothyroidism. Cardiac murmur through is not that common. Okay. 27-year-old woman with anxiety and weight loss as has tachycardia, tremor, and mild proptosis. What single mechanism account for her weight loss? Increase in metabolic rate. Yeah. Increased metabolic rate, the given feature of thyrotoxicosis in which increased metabolism cause loss of patient's weight. Okay. A 19-year-old man present with weight loss, increasing thrust, and increasing frequency to going to the washroom. His father, grandfather, and two sisters have been diagnosed with diabetes mellitus. What is the most likely type of diabetes mellitus this patient suffers from? Moody. A key feature of Moody are being diagnosed with diabetes under the age of 25 and having a parent with diabetes in two or more generations. Okay. A 60-year-old diabetes lady presents with severe perianal and pain and swelling. What's the cause? Is anal abscess. Anal abscess, diabetes predispose infection to occurs easily. Okay. A 60-year-old woman has tiredness. She has noticed that her skin looks permanently tanned and she describes dizziness on standing up. What is the most likely electrolyte abnormality here? Sodium 120, potassium 5.9. This is tanned skin is hyperpigmentation and postural hypertension in a tired woman point towards Addison disease where hyponatremia and hyperkalemia is seen. Okay. 43-year-old woman has been feeling lethargic and tired. Her blood pressure is 160 by 90. sodium 140, potassium 3.1. What is most likely diagnosis here? This is a case of syndrome. Con syndrome. Here, potassium is less than 3.5, sodium is at its higher or normal, and hypertension is present, so no confusion that it's a Con syndrome. Cushing syndrome is a differential diagnosis, but it has typical clinical feature which is usually described if the question is for Cushing syndrome. Below picture reference Con syndrome. From the patient information, it can also be a Cushing syndrome. So we like to be sure we have to know aldosterone and renin level. Renin low, aldosterone high in Con syndrome, primary hyperaldosteronism. Renin low, aldosterone low in Cushing syndrome. Renin high, aldosterone high in renovascular disease, secondary hyperaldosteronism. Okay. A 68-year-old man with diabetes and hypertension was noted to have cholesterol level of 3.4 millimoles per liter. He was also noted to have microalbuminuria. What is the best drug to add to this his regimen? Is ACE inhibitors renoprotective and prevents progression of albuminuria? Okay. A female patient with hypertension and serum potassium is 2.7. Which hormone would you looking for? Aldosterone. Hypertension and hypokalemia is seen in hyperaldosteronism, so we should look for aldosterone. A 36-year-old man with diagnosed with glioblastoma seen last 5 months and has cerebral edema and is on dexamethasone. He has diarrhea and vomiting for last 3 days. He has been suffering from repeated falls today. What could be the possible cause of his fall? Is adrenal insufficiency. Prolonged dexamethasone use suppresses adrenal axis and intercurrent illness can lead to adrenal insufficiency, Addisonian crisis in such cases. Okay. 45-year-old lady complains of expressible galacturia, decreased libido and amenorrhea, weight gain and easy fatigue. Her serum prolactin levels are 1100. What is the likely cause of hyperprolactinemia here? Hypothyroidism. It is likely to be a hypothyroidism because prolactin levels in hypothyroidism may be 30 to 200, which means 330 to 4200. Through weight gain can occur, but fatigue is not a feature of hyperprolactinemia. Noma. Not a feature of prolactinoma unless it is a macroadenoma causing suppression of other pituitary hormone given prolactin level of 1100. Definitely from microadenoma. In macroadenoma prolactin level is 10 more than 10,000, which does not cause fatigue, so the case most likely to seems with hypothyroidism. Okay. A young girl who is known to have type 1 diabetes mellitus presented with drowsiness and deep breathing. Her sugar level is 20, her blood pressure is 120 by 80, and her mucosa membranes are dry. What would be the next appropriate step? Do here ABG. The ABG likely diagnosis in DKA where ABG is done to demonstrate acidosis. A non-diabetic mellitus was admitted with sudden loss of consciousness. What is initial investigation? Random blood sugar. Unconscious in diabetes, first glycemic change should be excluded by doing random blood sugar. A patient was admitted with erectile dysfunction, reduced facial hair, and galacturia. What is most probable diagnosis? Hyperprolactinemia. Okay. 32-year-old man has been repeatedly admitted to hospital for what was described as anxiety or panic attacks and palpitations. On occasion, he is found to be tremorless and hypertensive. A persistent weight loss is noted. What is the most probable diagnosis here? Pheochromocytoma. A 35-year-old man with type 1 diabetes mellitus is dehydrated with blood pressure 90 by 50. What is single most appropriate initial investigation? Do ABG here to rule out DKA. So guys, I hope till here it's clear for you. If you have any queries, any question, you can ask me, and if you still not subscribe my channel, subscribe it. Thank you. Good day. Goodbye. That's all for today.